So we have a comment here from one of our videos talking about giddiness, which has been persistent and which has been chronic. And the person is asking, can you undergo a gallstone operation if you have an upper cervical neck misalignment that goes along with things like dizziness, shortness of breath, pressure on the eyes? So essentially asking if the person has these kinds of symptoms like dizziness, shortness of breath, feeling of pressure in the eyes, the back of the head, is it safe for them to undergo a gallstone operation? And absolutely, as long as it actually is needed, then you should always talk with your doctor, talk with a surgeon who would be doing the surgery. If they advise that it is a need and a requirement for you to have this kind of surgery, then yes, it would be safe to have the neck misalignment and to have the surgery at the same time. Of course, talk to the doctor first to understand more about what is happening. But yes, if the doctor is advising a surgery is needed for your case, then I would always follow their advice. I'm sure it's going to be extremely professional, and the reasons why they're giving it will make sense for your case. What you can do, of course, then is assess kind of both these things at the same time. So you can go see, say, if you're not in Singapore, wherever you are in the world, you can go see an upper cervical chiropractor, and they will be able to assess if they'll be able to help with your neck at the same time as, say, when you're scheduling or arranging for the surgery. And then once you've recovered, then you can see them again afterwards to continue on with the care to make sure that that part is being assessed. I'd always think of it a bit like anything with health. For a lot of things, unless they're directly contradicting each other, which in this case this isn't, it's good to always go for both kinds of approaches when possible. It's kind of like if someone was trying to lose weight and they were just doing exercise, or they were just dieting and changing the way that they're eating. Really, the best way, of course, is going to be doing both, because both will combine together and give the best results. And same for this, if you do have something happening in your neck, but maybe you need some sort of operation, as long as there's no direct contraindication, which in this case there isn't, then it would be advisable to make sure both are being dealt with as best as you can, and what fits, of course, around different things, because these are two very different types of interventions. Let me know if you have any further questions. You can drop them down in the comments, or you can send me a message directly.